And then before we begin, I would just like to do a land acknowledgement. As here at CHFBC, we acknowledge and pay our respects to the Indigenous keepers of the traditional and unceded lands upon which our office and many housing co-ops are situated. That includes the Musqueam, Squamish, Tsleil-Waututh, Wasanic, and Lekwungen-speaking peoples. We acknowledge the impact of colonialism and that our presence here today was paved through a system of discriminatory and racist practices. We are committed to honoring, listening, and continuously learning from the diverse perspectives of these and other Indigenous peoples. I'll now introduce you to our first presenter, Dr. Amy Lubik. She is a policy analyst at Fraser Health Authority. She is passionate about improving the environmental and social determinants of health through research and democracy. Her experience lies in community organization with 5 years of community building, volunteer coordination, event planning, and social justice education. I'll now pass this along to Amy.
Thank you so much, Janice. I'm so grateful to have the opportunity to be with you today. I'm going to talk about the health effects of extreme heat and what can be done. The territorial acknowledgement is beautiful. That was already given, so I'll just acknowledge that I am coming to you from the unceded territory of the Musqueam, Tsleil-Waututh, Squamish, Coquitlam, and Stobo peoples, which is colonially known as. So I am going to try to be brief, but I'm going to talk firstly about the background of extreme heat and heat-related illness, vulnerability to heat, planning, and a lot of resources that can be shared. So to start with the background, when I first started researching extreme heat, I was working with BC CDC. And here in BC, up until probably last year, we didn't really think that we were as at risk as the rest of Canada from extreme heat. When we think about the temperatures that regularly were experienced by Ontario and Quebec. However, it's not necessarily the absolute temperature that puts people at risk. It's our planning and how prepared we are and how used to the heat that we are. And so these graphs, and nobody has to memorize anything, but they're trying to get across is that once we reach fairly high temperatures over 30 degrees, where we still see a significant amount of heat-related mortality in BC. And in particular, it happens in the coast. Sound is coming in and out. Is that better? Thank you so much. In particular, it's actually the coast and the island that get the most extreme heat-related deaths, and the north. And part of that has to do with having plans in place and how our infrastructure is built. We really don't have a lot of air conditioning, and up until last year, we really didn't have a lot of plans in place for extreme heat. And so here in BC, the first real extreme heat event that we had was in 2009, and we saw over 110 extreme heat-related deaths. And since then, the BC CDC and Environment Climate Change Canada have been working on a heat alert response system, or HARS system, or BC. And 2021 was the first time we had to put that to effect. And as everybody knows, we did see an increase of over 740 deaths due to extreme heat last year. And since then, we've been learning a lot about how to prepare people for heat, especially our most vulnerable. And we've been working with the province, different nonprofits, and housing organizers to try to make sure that this year and every year we're learning more and putting those supports in place. And so for those who are familiar with it, BC has a new heat alert response system for 2022, my apologies. It's a two-tiered system that the public sees. And the first part of the system is our heat warning. And of course, we're all experiencing that right now. And this is the second time for this summer. This is associated with a 5% increase in mortality. It's very hot, and it happens 1 to 3 times per season, usually. The criteria, and I'm more familiar with Fraser Health, but you can see the criteria from across the province. And that is when the temperatures reach abnormally high, basically, for at least 2 days, or projected to reach those temperatures, and don't fall below in the lower mainland they don't fall past 16 degrees in the evening. So it doesn't give people a chance to really cool off. And you can see the different temperatures are kind of adjusted for what's the seasonal normal for different areas. What an extreme heat emergency is, and that's what we had last year with the heat dome, it's associated with a 20% increase in mortality. It's dangerously hot, and it happens 1 to 2 times per decade. It is the same thing as the heat criteria for a heat warning, but instead of only 2 days, it happens for 3 or more consecutive days, and temperatures increase day over day. Next slide, please. So our bodies are only really built to function within a very narrow temperature range. And vulnerable factors aren't just our bodies, but it's our social environment, our social standings, and our environment as well. So for vulnerable people, and we'll talk about who those are in a sec, bodily stress begins at around 26 degrees. And once we reach 31 degrees, we become in the danger zone. So it's important to really monitor the temperatures, especially inside, and we'll talk about that. So those who are most vulnerable tend to be seniors and people with chronic illnesses, people with cardiovascular or respiratory disease, and people on certain medications, and people who are confined to bed, so can't really have all of their needs met by themselves, and also people with mental health, and particularly schizophrenia. Now, for seniors, one of the reasons why they're more vulnerable is that often as we age, our body's cooling systems don't work the same way that they used to. And so it's harder for people to tell whether they're overheating, and harder for them to tell whether they may be getting dehydrated. And so it's particularly important to be checking on those people and to talk to them about whether they have heat plans. For people who have chronic illnesses, their bodies are already working very hard. And so when you put them into the heat, there's even more stress, particularly in the heart and the lungs and the kidneys. Next slide, please. And one of the things that a lot of people are not particularly familiar with, and I know I wasn't until I started in this field, is that certain medications actually put people at more risk as well. So things like antihistamines, decongestants, anticholinergic agents, and a number of antipsychotics and antidepressants tend to either interfere with the body's own cooling systems or interfere with whether people can sense that they may be overheating. They also can interfere with, especially things like diuretics, can interfere with people's ability to regulate their hydration levels. And so people have more of a chance of becoming dehydrated and becoming sick. And there's also, so we recommend that people talk to their healthcare providers, including pharmacists or their doctors, in order to take more precautions in the heat. And similarly, some of the substances that folks may use for dependence issues, like alcohol, also and cocaine and amphetamines, can also interfere with some of the body's cooling processes or the ability to kind of understand whether you are overheating or not. So it's very important to keep those things in mind. Next. One of the most critical points of this conversation, and one of the reasons why I'm so glad to be invited here today, is that it's not just the body's physiology or your bodily conditions that put people at risk, but it's really the social and environmental conditions that people live in. So people who live in low income housing, lower quality housing, or lacking AC in particular, or people who are socially isolated tend to be those who are most at risk in these kind of events that we're experiencing now. And these populations also tend to live in areas that are more environmentally vulnerable. And I'll talk about that in a minute. Next slide, please. But what I really wanted to underline before we move on is that taking neighborhood and even building level interventions can make a huge difference for people. So this is a couple of study slides from a study of the 1995 Chicago heat wave, and it's comparing two different low-income neighborhoods. I do want to acknowledge that it does talk about African-American neighborhoods and Hispanic neighborhoods, and really there's nothing that puts those groups at risk, although they are disproportionately at risk. What puts them at risk is the social discrimination and the historical discrimination that they faced. So when we talk about the poor African-American neighborhood, it was a place where there was lots of crime and people didn't trust their neighbors. And so people kind of stayed in, closed their windows, and a lot of people lost their lives. But in the neighborhood next door, there was a lot more social cohesion, and people spent a lot more time outdoors, and people checked on each other. And the mortality rate was significantly different. And so being able to get to know your neighbors, to check on people, and to spend more time outside and feel safe spending time outside is really important in these kind of events. Next slide, please. Moving on to the environmental factors that put people at risk. Obviously, buildings make a big difference, and a lot of the buildings in BC aren't, especially the lower mainland, the north of the island, aren't really built for the heat. So we don't have a lot of mechanical cooling, and that's especially hard on people who live on the higher floors under the roof. Having single pane windows and large window surface areas, and also low neighborhood greenness is a huge factor. Having a lot of trees and greenness in a neighborhood can actually bring down the temperatures by 2 to 10 degrees. So that's really important. And often folks who are most at risk tend to live in neighborhoods that are that really do contribute. So the places, again, where there's not a lot of greenness, where they lack air conditioning, where there's a lot less vegetation, and often actually in urban heat islands. So that's where there's a lot of tall concrete buildings and actually traps heat and pollution, which creates an even higher temperature. There are ways that communities can mitigate these things, and they can put it in longer term heat mitigation strategies. Next slide, please. And just to highlight this, I always think this is a very impactful, at least for me, slide. When you look at on the left, Manhattan, during a heat wave, Central Park is around 10 degrees cooler than the surrounding area. And similarly, if you look at Metro Vancouver, in our heat wave, we saw basically a lot of urban heat islands. We saw a lot more coolness where there is green space. And I think what's important to highlight as well is that a lot of these urban heat islands and places where there's not a lot of green space actually overlap where there's a lot of socioeconomic inequality or poverty. So there are places around the world that are starting to make sure that when they're looking at increasing their tree canopy, they're particularly looking at the more vulnerable and low income areas. So I just have a couple of slides about how this impacted our healthcare system. So we did see more emergency department visits in more socially deprived and economically vulnerable areas. Next slide, please. And in particular, the folks that we were most concerned about, as we talked about before, tended to be those adults in 65 and over. Those were the ones who we saw come to the emergency departments. They're also the people who lost their lives. But we did see in that particular event, we saw an increase in death in all age ranges as well. And we have been preparing more for people in acute care and residential care. But what we saw in the heat dome, and I think everybody's familiar with this now, is that it was the people in community that weren't connected to care that we lost more than in any other factor. Thank you. But it's important to highlight, it wasn't the people in community outdoors that we lost. People died because of the heat inside. And there's a lot of things that we can do about that. This is a slide about some temperatures in Abbotsford during the heat dome. The black line you can see is the temperature outdoors as measured at the Abbotsford Airport. The blue line is in a house in Abbotsford that had air conditioning, and the red line is in a house that had no air conditioning. And it's pretty stark. So you can see in those higher bumps, that's the most intense days of the heat dome, the peak of the heat dome. And you can see, of course, that the home that had air conditioning was very safe, very cool. They had no effects. So if there was someone who was vulnerable that lived there, they were protected. In the house, sorry, just a little bit more on that slide. In the house that had no air conditioning, it follows very closely to the heat dome curve. And inside, you can see also that it gets hotter inside at a later point in the day than it does outside. So especially when people are trying to go to sleep, and that makes it very difficult for people. But also we tend to think that the temperature inside is going to normalize to the temperature outside, and it really doesn't. So during those heat days, the temperatures actually build up within people's homes, and it can stay like that for up to a week afterward, especially if we have a couple of more hotter spells. And you can see that this orange box denotes between 26 and 31 degrees, which is kind of the dangerous area for people. And so we had those extreme temperatures inside, unsafe temperatures inside, for a lot longer than we actually had the heat dome. So if there was someone who lived there that was vulnerable, it was very dangerous. Thanks. But there are lots of wonderful things that we can do that we've learned about. And especially with community partners and the health authority and municipalities, we're really recommending that all organizations have heat and smoke planning. In particular, monitoring the weather and indoor temperatures, developing clear plans with roles and responsibilities. One of the key parts is identifying susceptible individuals prior to hot seasons, so there can be people in place to check on them. Identifying and establishing links with partners. So thank you so much again for having me here. Developing and sharing communication materials, and doing whole season evaluation so we can make sure that we are always improving. Next slide, please. We are working with a number of NGOs, and so this is kind of what we're recommending. And we'll talk a little bit more about landlords and other housing providers in a minute. But really displaying heat information in all the venues and making it easy for populations to understand and to see. We do have some resources that are available in multiple languages if needed and larger print. Establishing cooling spaces on site where possible if there isn't air conditioning. Assessing whether there's cooling centers nearby if that's something, if they're needed. So sometimes not making a cool space is not going to be accessible for people. It's not going to be easy to do, but a lot of municipalities are now putting up cooling spaces or at least opening their libraries, etc., for longer hours. But assessing whether or not there's ability to transport people is also important. And of course, encouraging wellness checks for people at high risk. And we do have, I will talk more about the resources that can help with that. Next slide, please. What we're specifically, along with Vancouver Coastal, recommending for Stratas and Landlords is to ensure that any policies or bylaws that prohibit cooling measures, such as window coverings, awnings, and air conditioning, be re-examined and potentially relaxed or stricken. Bulk buying programs, if that's something that people are able to do. Completely aware that it's not easy for everybody and there's capacity issues. And of course, setting up check-in programs for residents and opening cool rooms. Next slide, please. One of the biggest things is just recognizing the signs of extreme heat. Not everybody does. And heat exhaustion is one thing, but heat strokes are another. And so when we talk about putting up cool rooms and checking on people, if an organization does decide to do a cool room and somebody's in distress, people don't need to have medical training. That's just the time to call 911 and get them medical help. But making sure that we know how to recognize when people are having trouble is really important. And so that's for both staff and residents. One of the things that we're learning, and is really just coming up now, is that fans can feel really great, but they don't necessarily help very much when it comes to overheating, because fans don't directly cool the air. They can kind of offer a sense of relief when people may actually be overheating inside and they can't actually lower the core body temperature. So having a fan for some relief is fine, but for people who are vulnerable, really getting them into measuring the temperature and getting them into a cool space is much more impactful. Fans are very useful to put in windows to move the air, specifically cool air from outside inside. But again, they should not be the primary method of cooling, and people really should move to a cooler space or even go outside to a cool, clean space. Next slide, please. This is about the cooling spaces, but one of the things that we just try to highlight is that it's important that these cooling spaces are open if we do put them up for longer periods of time well into the evening. As we saw, places don't cool down very rapidly and not to really particularly comfortable levels. And it's really important to make sure that people feel, if we can, that people feel comfortable bringing their pets, because pets are family, and people will not leave their hot rooms or their hot apartments without a place to bring their family with them. And it's also important, if possible, to have something to do, because people sometimes think that it's just somewhere where you go and sit for hours, which is not that appealing. Next slide, please. And so this is a non-exhaustive list, actually, of all the resources that we can provide to help. These are all up on the Fraser Health Extreme Heat resource page, which is the first link. I guess one of the things to highlight is that there is a primer for physicians and pharmacists, which you don't have to be a physician or pharmacist, but if people are on certain medications, that will help identify who may be at risk. And next slide, please. And this year we have some brand new resources that I'm hoping will be very helpful. The BC CDC harm reduction team has a number of harm reduction and mental health related links and resources, whether that's for cooling kits or for what to do if people are experiencing overheating, how to prepare. We have a heat poster, and you saw the top of one in our presentation, but that heat poster is not only how to recognize the signs of extreme heat exhaustion or illness, but how to make people feel cooler and what to do, what steps to take. And that's available now in about 9 languages. The Prepared BC Heat Guide is from the government of BC, but it does give a lot of really great resources, and I think it's available in 4 different languages. We do have a wallet card on the Fraser Health website, which you kind of have to reach out to somebody to order those, but it's a very easy thing to distribute to people so they can have access to more resources and know where to go and where to look. We do have recommendations for Stratas and Landlords on our website, and prepared social media messages that can be shared. And we also have I almost forgot about it, but we do have a new resource that's particularly around seniors and people with chronic and what to do to take care of them in a heat episode. One of the most exciting things, though, this year is we have heat check-in guides. One has been developed by the National Collaborative Center for Environmental Health, and that shows how to do check-ins either remotely or in person, who to look at, what questions to ask them. So that can be for anybody. The other guide on the right is by Vancouver Coastal Health. We have a Fraser Health version that's just been updated with our contact information, but that's more for NGOs and how to both set up a check-in program and what questions to ask and how to basically triage if someone is experiencing some symptoms. Next slide, please. And so I think I'm over time, so I will skip this one. I know that you can read it, and it's in the guides, which will be linked. And the last piece is really around alerting resources. We do, of course, see things in the news, but if you download the WeatherCan app, it shows kind of real-time alerts of extreme weather, not only extreme heat, but also air quality warnings and floods, etc. Hello weather if you're more comfortable on the phone, and public health alerts will be issued by Environment Climate Change. And I believe that's it. So thank you so much.
Great, thanks, Amy. So I'll just give it a moment to, for any questions you may have. Again, you can type it in the chat or in the Q&A box. Okay, it doesn't seem to be there's any questions, but again, if something comes up, feel free to contact us at education@chf.bc.ca. And I would just like to thank Amy again for this wonderful presentation. I'll now introduce Jackie Kloosterboer. She is a disaster preparedness specialist who firmly believes that families prepared for disasters will better survive in the aftermath. Jackie, a recipient of the Queen's Jubilee Award for her dedication to helping people during times of disaster, and received the Justice Institute of BC Instructor Excellence Award. Various media outlets across Canada often interview her as she promotes the importance of emergency preparedness. I'll now pass it on to Jackie.
Great. Thanks, Janice. Are you able to hear me okay?
I think your sound's coming in a bit in and out.
Okay. How about now? Is that better? Okay, yes. Fabulous. So beating the heat and staying cool, and that is top of mind for everybody right now. As you know, we've seen very high temperatures, and we need to be aware and to look after ourselves, but also to look after those people around us. So next slide. So tonight we're going to talk a little bit about the importance of staying informed, knowing what is going on, and what you can do if you're staff and management within a co-op, and how to prepare your co-op. And we're going to look at it both from the co-op, but also the people, you know, those of you that live in co-ops, what you can do to stay safer during these hot times. We'll talk about a few tips for staying cool, and then I'll touch on wildfire smoke and some ways to stay safe with that. So staying informed, you know, simply posting a notice board, having information where, you know, people can see what's going on. Amy had some excellent slides there with some information. Posting, you know, that information can be really important, and that can really help the people within your community. And I understand, I've done a lot of work with disaster preparedness, and, you know, right across our province, we all live in different areas, we all live a little bit differently. So, you know, what we do is really going to depend on our own unique situations. When we're looking at the staff and management, you know, having a heat plan, have a plan that you can take out when it starts to get hot. Ideally, you're going to do that before the heat impacts us, but have a plan so you're not going to forget what is in the plan. And keeping your office cool, having some fans, having other ways to keep the air in your office cool is going to make a huge difference. Having access to water, if you've got a window that you can open, if it's shaded, different things like that. But if you can identify that before we're in the middle, of a heat event, that's going to really help you. And what options do you have to keep cool? I know, a lot of people, I've been working from home. I'm now going into the office to work because I can stay cool and we've got air conditioning. I don't have air conditioning at home. So knowing what your options are, some people will, start a little bit earlier in the morning and finish a little bit earlier. And it really depends on, what it is that you do. But if your co-op, if you can do that, that is definitely going to help keep you cool. Next slide, please. So other things you can do, having cooling systems. I know we don't all have air conditioners and, pros and cons to all of that with global warming. And, I certainly understand all that, but identifying how you can stay cool. Your common areas. If you're in a co-op, you may have like a meeting room type area or even an outdoor area where if you can set up chairs and, keep it available for people, even to get a break from their apartment so they can go down, cool their bodies down before having to go home. I'm in Vancouver, and I know Vancouver and many other communities do have cooling centers open where, libraries, community centers have extended their hours just to provide people the option to remain cooler. And then limiting your activities. You may have gardeners that come into your co-op to do work. Well, maybe you can put it off a little bit. Maybe you can have them come in earlier. So simple things like that can make a huge difference. And your co-op better than anybody else. So sitting down with the people that run your co-op, coming up with some of those ideas, put it into a document and you have it. And next year when it gets hot again, you'll be able to bring it out. Next slide, please. So I touched on this a little bit already, but having that area, it can make a world of difference to people. And, I know Amy talked about this as well, but having a method to check in on people. And, I live in an apartment, it's an older building, no air conditioning, and we have a lot of elderly people here. And we just go and knock on their doors, check in, make sure they're okay, make sure they've got water in that. And, that makes a world of difference. And often people don't know how hot they are until, it's too late. And we've seen some very unfortunate deaths happen through that. So, if you do have elderly people, with disabilities that may not have easy access to get down to cooling centers, even having, a cool shower, different things like that can make a world of difference. So think about within your own co-op, who are the people that may need some extra help? What can you do to help them? And as a co-op, having that plan is going to make a world of difference, especially for the people that, may not have easy access to get out. So do what works within your co-op. Next slide, please. Staying cool, drinking lots of water, and it's critical all year round, but especially in the heat. Make sure you increase the amount of water you're drinking and stay out of the sun. You may have to go out but plan it for when the sun's not shining brightly, but definitely, avoiding the sun can make a big difference. And the clothes that you wear, loose fitting, breathable clothing, is going to keep you a lot cooler than wearing some of the other types of clothes. So just, think about what you're doing and, how that's going to have an impact on you. Next slide. Showers to cool down, hopping in a cold shower cools you down very quickly. So, that can definitely help. Having a damp face cloth or a towel that you can drape around your shoulders. And if you Google popsicles, there's over 35 different types of popsicles you can make. So have some fun with popsicles. If you've got kids, make it a game, have some fun with it. And, that can definitely bring the temperature down. Electric fans or handheld fans can certainly help, and not your only source of cooling, but it can definitely help with the process. Also, the pools that we use for kids in that. A few slides back, we had the little baby in the little water pool, and that can be fabulous. But just keep in mind with that, don't leave your pools unattended. You're not the only little kids living in the area. There may be others. So if you do have a pool, make sure it's emptied and flipped over. You don't want to be having other dangers happening as well. A lot of people, they will put a damp t-shirt in the freezer and they'll pull it on after. I have certainly not tried that yet, but I have a neighbor who swears by it. So, look for things that you can do to be cool and look out for your neighbors. That's really important as well. Next slide. And our pets, for those of you that have pets, a number of things you want to be careful about with pets. The sidewalks can get very hot, and, having your dog walk down the street on a hot sidewalk can burn their paws. So think about that. The cooling centers, and I can only speak to the ones in Vancouver, they will allow pets within the cooling centers, and it gives people an opportunity to come in with their pets and get a well-needed break, sit in the cool, and definitely that is going to help you stay cool during this weather. But again, your co-op, your people within the co-op, and do what you can. And a number of resources that you can reach out to. There was a few put in the chat, but follow what Vancouver Coastal Health, Fraser Health, your community, City of Vancouver, City of Burnaby, they all are posting information and getting the information out, and post that information on your community notice boards. Send out an email if you can, and check on those people that need to be checked on. Next slide, please. Wildfire smoke, not an issue today. We do have a few wildfires burning, and as those continue to burn, there definitely is the potential for smoke to come into Vancouver. You were here last year, you definitely suffered with it. And, we had so many fires in Vancouver, and there were days where it was really dangerous to go outside for a lot of people. So keep that in mind, especially, if you or people in your family have any, significant health risks, you don't want to be going out into the smoke. And you can monitor those conditions as you can with the heat by watching the news, Googling the heat. Just make sure you're referencing, a reputable site, but following what the different conditions are. And if the smoke is really bad, stay indoors, keep your windows closed so the smoke doesn't get in. But again, with the heat, and the smoke, you're going to have to sort of balance that out a little bit. Easier said than done in some situations. And again, limit your activities. So just to be very careful, and, with the heat, with the smoke, if you have any concerns, always check with your family doctor or your pharmacist, and, people that can give you that information. And that is pretty much sums up what I have to say. But again, I'll take it back to the importance of looking out for your neighbors, and, keeping in touch with people, and knocking on a neighbor's door and just saying, hey, how's it going? Just want to check in and make sure you're okay. And doing that really could save a life. So think about the people in your co-op that may need some additional support.
Great, thanks, Jackie. So again, if you had any questions for either Jackie or Amy, feel free to type it in the chat box or in the Q&A. Okay, so one question came up. Could Amy, this question is directed to Amy. Could you talk with Vancouver planning about its push on higher density, which destroys green space? Lenore, could you please clarify your question if possible? So I'll just give them a moment.
Well, she's typing. I could just add that for Fraser Health anyway, and then we do work fairly closely with Vancouver Coastal Health. We have specialists called Healthy Built Environment Specialists who do work with cities to talk about how to include green spaces in new developments and how to basically make those complete communities. So I can't talk specifically about like destroying green space, but I can say that health authorities are promoting inclusion of green space and the preservation of green space and ecosystems within and new developments in the city.
Great, thanks, Amy. And I know a question that came up a little bit earlier on the fact that air conditioning adds to global warming. Is there any other suggestions, such as cold bathtubs, that could be as effective as air conditioning?
Putting your feet in a tub of cold water, that'll bring your temperature down really quick. I don't know if that's appropriate, but I know it works. It's just being creative, and you know, some of the basic things that we can do, we don't think about it, and you know, it can really make a difference. So I know a damp cloth, I did that this afternoon. I was in home and it was so hot, and it felt really good. It cooled me down, and you know, for a while I was good, and then it gets hot again. So you have to be creative.
Yeah, and I'll just add to that, and those are great suggestions. That type of bath, like putting your feet in the cold water, immersing yourself if you can. What we're really trying to accomplish is getting our core body temperature down. So even when we feel kind of cooler on our skin, it kind of stays within our body. So doing those type of things and putting those cool packs and things like that, cool clothing, cool damp clothing can help. And I guess where possible, if there are kind of cool green spaces that you can go to, if you have that ability and it's accessible for you, that's also really helpful, that getting outside into those green spaces.
One thing to watch for, and there have been some cases of hypothermia where people have been jumping into cold lakes and things like that. Maybe not quite so much in Vancouver, but we had a very late runoff this year with the snow melt and that, and our lakes are still significantly colder than what it should be at this time of year. And apparently there was a couple of cases where people jumped in and it was not good. So, you know, if you are going into water, go in slowly and test out the water before you go in, but definitely something to watch for.
Great, thanks. So I'm just gonna see if there's any other questions. Okay, and I know there's a few questions about funding and fundings for co-ops. At the top of my mind, I don't know, I'm not aware of funding specifically for air cons that co-ops can apply for. We recently did have a sustainability grant earlier this year, which Granville Gardens had received to get a heat pump for their common space. We might be having it again next year. Oh, and then besides air conditioning. So I believe the question about what you can do besides air conditioning was answered by both Amy and Jackie. Sorry, and again, for about the funding, I don't have that information on top of my mind. We might be having another sustainability grant next year, so please be on the lookout for that. I know CHF Canada has a similar grant as well, so you can check out their website for possible grants on potentially installing air cons in your co-op. But CHFBC, we are looking at for more programs and funding for co-ops that co-ops can apply for air cons, and we will be providing that information on our website as well. CHFBC, we also created a checklist. Not air cons, heat pumps. Okay, great. And then I'll just be sharing some resources that CHFBC has created in the chat box. Or some resources and checklist. But yeah, if you have any questions in general that were not answered today, please contact us as education@chf.bc.ca and we'll try to our best to get back to you. Okay. I was wondering if there's any other questions. Again, you can feel free to put it in the chat box or a Q&A box. Okay, and there was a question from Heather. Are heat pumps more environmentally friendly than traditional air conditioning?
Generally they are. Yeah.
Okay, great. And Amy did say in the chat, in case everyone's not reading the chat, that you can also keep your windows and blinds closed, especially heat reflective coverings. Keep things closed during the day and open at night to bring in cool air. It may not be as effective as aircon, but it is better than nothing.
And hopefully by Sunday, Monday, we'll be out of this heat wave and we'll be glad it's behind us.
Can I also just add that for a lot of municipalities across BC, they are opening their own cooling shelters. No, not everybody feels that comfortable going to them, but going onto the city website, it should be able to say where those are. And sometimes they're misting tents outside, and sometimes they're like the library's open for longer hours. And I know that sometimes it's hard to get to those places, but it is a nice respite for folks if they can't get there.
And even if you're going grocery shopping, great exercise, walk up and down all the aisles. It'll keep you in the store longer and you'll cool down. So sometimes we have to be a little bit creative. I can only, again, speak for the city of Vancouver, but if you go to their website, and I know you've got a lot of co-ops in the Vancouver area, all of our misting stations, all of the centers that are open with extended hours are all posted there. And as Amy said, a great way to go and cool down. Just bring a book with you. And, you know, we get moms going in with little babies and too hot at home for them to have a nap. And it just gives the baby a nap and mom a bit of a break. So that can be really helpful.
Great, thanks so much. Yeah, so if there aren't any more questions, thank you again, Amy and Jackie, for presenting on possible ways to address the heat wave. Hopefully that gives everyone in this session more ideas on what to do if aircon is not available at the moment. So I just want to say thank you everyone for joining us. I hope you have a great evening. And again, these slides and the recording will be available by tomorrow. Great. Thanks so much, everyone.